Welcome to Inside Maine Healthcare. I'm Joel Allenbaugh. Well, Dr. David Howes, CEO of Martins Point, will be joining us to talk about the shift to population health. Stay with us.
Inside Maine Healthcare is Maine's only show dedicated to healthcare in Maine, brought to you by the healthcare industry and business leaders. Inside Maine Healthcare will bring you the practical information you need to understand what is driving our healthcare costs and identify the resources available for you to better manage your own healthcare. Learn how healthcare reform, new laws, and policymakers impact Maine business and consumers. Find out what business can do to offer affordable, comprehensive healthcare. Join us as we discover and implement innovative solutions to Maine's complex healthcare challenges to provide Maine people more affordable, sustainable, results-driven healthcare.
Welcome back to Inside Maine Healthcare. Well, joining me today, a familiar face, Dr. David Howes, CEO of Martins Point Healthcare. Thanks
Good morning,
so much
Joel.
for being back.
Nice to see you. Nice to be here.
And nice to see you as well. Well, we were going to talk a little bit today about this whole concept of population health. And for a quick lead in, the provider community in general is, I think, used to sort of getting patients at the worst possible times when we're sick, we need assistance. But there's a shift going on, and maybe you can provide some insight.
Well, Joel, it really is interesting. It probably started with Dr. Sid Garfield out at Kaiser in the late 50s, early 60s, as he began to realize that many of the people coming to be cared for had already passed a point in the course of their disease where it was possible to really help them in the maximal way. And so he began to look at the work of saying, what are people's risks? Whether it's very young, where it's the need for vaccinations, or a little older, where smoking cessation and weight management would be important, or a little older, the help with managing and being sure that you understood every patient in your practice who had a disease like diabetes.
Right.
And you took really good care of them as a group, building out processes that take good, consistent care of them. And it is really being demonstrated that if you have a lifetime in a population health system, your health is better and your total costs of care are better. And those are both important things.
When as I sit here and I think about this, I mean, we're watching this attention to payment, the payment models
Yes.
in our existing delivery system, and it's been dominated by this fee for service. You know, I get paid as a doctor when you come in and see me. And we're seeing that start to shift, and I'm thinking of some of the more recent innovations.
Mm-hmm.
You have the movement toward patient-centered medical homes, accountable care organizations, which is essentially telling the provider community or the provider system, be accountable to the patient. So I think we're in a lot of ways talking about the same thing. The payment system starting to move in a direction that enables more of a population health approach. Is that accurate?
That's absolutely right. You know, Joel, I don't know that many people have thought about this deeply, but if you think about it, what you realize is that the way we pay for care determines what we get for care.
Right.
And they're really now recognized to be two sets of things we want from the healthcare system. We want you to be able to come in and see the doctor right away with the cold, the pneumonia, the laceration, the stuff that needs to be taken care of. And we want everyone to have a medical practice that knows them and their risks and their illnesses and their challenges, and that is staying ahead of them. And if they don't show up for a year and they have diabetes, calls them up and says, wait a minute, we really are concerned about your risk here. Let's get you in and have that conversation. So there's two families of tasks, and they probably need to be paid separately and in different ways. You do want those people to get that quick visit when they need it, and you also want that practice to be taking care of the group of people who, you know, have essentially said, you're our doctor or you're our practice.
So if you, average physician group,
Yes.
ready for this?
Oh my goodness. I will tell you that, you know, we're at Martins Point, of course, and we've been working on it pretty hard. And what we've come to recognize is just how challenging it is. You know, if I think of my dad, who was an old GP, I recently looked at some of his medical records, and they had 3 words on them from each visit. Well, now when you come in to see the doctor, if you want to have a population health system, they've got to collect a lot of information about you. And then they've got to put that into a system so that you get called at the right times for the right things. And that you get the right care. That it may be that your issue is overweight, and instead of seeing the doctor, the call-in may need to be to talk to the dietitian.
Right.
And so the medical system is just beginning to wrap their arms around this as an important responsibility. And I think there's a lot of growing enthusiasm and support for it in the primary care community, in the ambulatory, outpatient world. But it's going to take us a while.
Yeah, you're talking about that's kind of the point I was getting at. You're talking about some real systemic type of changes and some processes that need to be in place that I expect most practices just simply, they don't have today.
Exactly. I'll tell you a story. 6 months or so ago, I was talking with Rich Peterson, who's the leader of the Maine Medical Center. And he was talking about how they, have all these beds. And I said, my dream is that in 5 or 10 years, you won't need those beds. But the point is, if we can get population health right, we can really reduce the need for the big, expensive, and for patients, risky and unpleasant care.
Do you see some resistance? I've had people for many years telling me, Joel, you need to go read the book, Who Moved My Cheese?
Yes.
And I read it over the weekend.
You did?
It's a quick read.
Yes, I've read it.
And it's this whole concept of just human nature to resist change.
Yes.
And what you just said, your vision is that they will not need so many beds. I'm guessing that may conflict with what their particular vision as the provider of those beds may be.
Joel,
there's a shift coming. In other words, there's a lot of people I think who are probably holding on that need to start by letting go.
Absolutely. I think there are a number of things. We have a system that has a tremendous number of established, really, businesses in it. And one of the things we're working to do is to reduce the need for some of the care that's being delivered today. That's hard for people. There are other things, frankly, some people don't want to be called up to talk about their smoking or their diabetes, or to engage in that conversation. And some people feel like, I don't want the doctor to be my nanny. And so we've got, I think, some social questions we have to deal with. What are our expectations? And we have some medical system things that we have to deal with. And my sense is these are issues that are going to get worked out. One of the things that's gratifying, though, is that the population health initiative integrates beautifully with the work of a lot of our best employers in the state of Maine who are tackling this from the wellness perspective.
Right.
Because wellness is really population health in the workplace. And it's intended to reduce the cost of care for the employer, but it's also intended to make his employees healthier, more productive, and happier. And so what's really quite exciting is to watch these different pieces coming together. And the return will be over many, many years.
Right.
But I think that it is potentially very substantial.
This alignment that you're discussing is, I think, a critical component of it. You have, I was talking about this at an event last night, you have the patients, you have the payers,
Yes.
and you have the providers. And in today's system, everything's misaligned. There's a lack of cohesiveness, I think, in so many respects.
You're very right, and I would tell you that we've been talking about this movement for the past 10 years, I would say. It was a little conversation at first, and now it's become a big conversation. But what the family physicians and the internists and the pediatricians were saying was, wait a minute, we're out here all alone trying to deal with these issues. We need more support for this. We need support from the employer. We need support from the payer. We need support from the community.
Right.
That these are right and good things that we ought to be doing. And I think that they're beginning to feel as though the tide is turning and they're getting support from multiple sides. And in fact, the training of a physician and the work of a physician and the work of their staffs is really about keeping people healthy and well. And so I think they're finding, they're at the early stages of finding this to be very gratifying, and I think it'll be very good for the delivery system, for the healthcare system as well.
And when we come back, we'll talk a little bit about sort of getting from here to there, because
That'll
I think
be fun.
That's certainly the challenge.
It's a great conversation.
Yeah. Stay with us. We'll be right back.
MaineSense is not just health insurance. This is a new program based on reducing health insurance costs.
The costs were just too expensive. I couldn't put that on my employees with those type of premiums.
MaineSense is unique because it's an employer-owned health insurance company.
It's the kind of plan that I'd always dreamed of being available.
While companies across the country struggle with the rising costs of providing health insurance to their employees, Maine employers are taking action.
Well, I think all the other health insurance companies we've been with over the years have brought to us reduced benefits for higher premium, and our employees are looking for something more than that.
MaineSense is a health insurance program developed and owned by Maine employers in partnership with Martins Point Healthcare.
This is the first time I'd heard of a health insurance program that aligned the interests of employees, employers, and the healthcare providers.
It is a plan designed around preventive care and reducing the overall cost of health care by keeping people healthier, keeping their health insurance dollars in their pockets.
I feel that going with MaineSense has empowered our employees. It's given them the tools to make the best healthcare decisions for themselves.
These and other Maine employers are taking a new approach to health insurance. Find out how to join them at mainsense.org.
I think MaineSense is right for companies that want to take a proactive approach to managing healthcare costs.
This is a win-win for everybody, and we're really excited and looking forward to making this happen throughout our organization.
Are you concerned about the impact of rising healthcare costs on your business? Hello, I'm Joel Allenbaugh with National Worksite Benefit Group. Confused by the ever-changing laws, regulations, and compliance requirements? Struggling to educate your employees on the details of your benefits program? Let our recognized experts at NWBG take the stress and frustration out of these complex issues for you, so you can focus on building your business. Go to our website or give us a call today for a free consultation. Welcome back to Inside Maine Healthcare. Well, we were talking a little bit about this sort of shift to a focus on population health, and I can't help but think about getting from here to there. And I think that they always say the devil's in the details.
It sure is.
One thing that comes to mind, I'd love to hear your reaction. You know, you talk about sort of the way the payment structure is, and obviously that needs to change in and of itself, this shift from fee-for-service. But as I think about a medical practice, it's not one person paying you. You know, you have a certain population of patients who may be on Medicare, a certain population who may be within the Medicaid system, a certain population that are with private carriers, insurers, but it might be insurer A, insurer B, insurer C. How do you make that shift when perhaps they're not all making the shift in their payment arrangements at the same time or at the same pace?
You are really asking about an important question. You know, we have 60 primary care physicians and about 20 nurse practitioners and physician assistants, and the primary care field has been struggling financially for a fair period of time. And one of the things that we've come to recognize is that we're receiving payment in many different forms. For some individuals, we receive payment for all their care per member per month. And at the other extreme, we receive payment for every little thing that we do.
Right.
And the only answer that we've been able to come up with is to manage each of these the best we can and to build a single path of care. And that path of care, you know, has to be, it has to be a population health path. And every person who is a patient in our practices is in our population health system now. And every patient gets the same calls and the same notices. Now, if you take a look, they're being paid totally differently.
Right.
But for a medical group, you can only practice one way.
Right.
You know, you can't look at who's paying and then say, well, you don't get this,
Right.
or you get extra of that. And so it's been it's a real challenge for the practices. And I would really like to see us move to a place where at least all the payments rewarded relatively similar things. The Maine Health Management Coalition has done a fair bit of work and is continuing to do work to try to achieve a payment reform that would build a good deal of consistency into the way in which physicians are paid. And I think that will help quite a bit, Joel, to have a standard, a gold standard for payers to work from.
Yeah, because I think what you've described requires a certain amount of vision, and it's sort of a willingness to see where you need to go and start behaving as if you were there today.
Yes.
And make the internal adjustments you need to make the current, I'm going to call it, fragmented payment system work in that context.
Yes.
I'm not sure every practice or every physician group or every hospital or however you might categorize it is going to have that same vision and that same drive. Do you think that that universe of where we need to go is, I need a better word, but is it somewhat universal? Is the provider community at large recognizing, or do you think that there is some awakening yet that needs to happen?
There's enormous fragmentation, I think. I think, the great majority of primary care physicians now work in hospital systems. And hospital systems are becoming increasingly squeezed, and payers are, by and large, paying for the number of visits. And so for a hospital system to pass along to their employed physicians payment that's based on the number of visits is pretty standard.
Right.
With some slice of that that's for quality, measured for just a couple of small items. And so I think we're really in a place where there's a fundamental need for a change in the way that the payment comes in, because it's a two-step process. The hospital gets paid for the physician's activities, and then the hospital translates that into a payment methodology.
Right.
And so the first thing we've got to do is get the dollars coming in for the stuff we really want, which is this preventive care, population health, wellness. And then the second thing is to work with all these institutions to change the way that they actually pay the doctor.
Right.
So if the doctor's doing a great job of preventive care and of managing the populations, that he gets or she gets paid, rewarded for that.
And you referenced this before, but there's a culture shift that needs to happen as well. So I think we're focusing a little bit on sort of the provider and the payer aspect of it, but most of us access the health care market through our health insurance plans.
Yes.
Most of us buy health insurance plans through employers.
Yes.
And I think there's a lot of crossover in an employer having focus on the health of their employees, not just in terms of the hard dollars for their insurance plans, but for the productivity and those different aspects and presenteeism and absenteeism and all those aspects. So there's a role, I think, for the employer community and then for the individuals themselves. And I think you hit on it. We have to come to recognize what our role in this process is in managing our health, and we need to be open to that relationship
Yes.
that you're describing.
Absolutely.
Do you see the employer community, are they getting there, or is there more that needs to be done in that area
The
as well?
employer community is really beginning to move.
I think
at a national level, you're seeing IBM, all in on patient-centered medical homes. At the local level, we're seeing members of the Maine Health Management Coalition very strongly supportive of the patient-centered medical homes. There is one other little hitch in this, though, and it's worth thinking about. When I started in this work, roughly 18-20% of total medical spend was in primary care. It's now down to 7 or 8%. It's a very small piece. At the same time, we're not only asking them to take care of all the acute stuff that they were always taking care of when the patient called them and they came in,
Right.
the cold, the sore throat, et cetera, but we're also asking them to build a new system that has a whole different set of capabilities than anything that they've ever done before. And that is going to add a lot of time and work. Furthermore, this can't be done by the same number of bodies. and so the need is there to build teams, to build electronic infrastructures, and to build systems in addition to what they've always done. And so there is going to have to be some shift of dollars from other areas into this.
Right.
And that means they're going to have to come out of somewhere else, because nobody wants to add to the total spend. I don't think that anybody thinks that's right.
Correct.
And so you can see that there's a big piece of work to be done here to get patient-centered medical homes built, functioning, operating, and to get them adequately and appropriately funded and paid for high performance.
And this speaks to that aspect of there's some growth, some change, some vision. You have to see where you're headed. Everyone has to understand their part to play, if you will.
Yes.
And there are some that their biggest challenge is going to be the letting go.
Oh, yes. Oh, yes. Absolutely. This is a big change in mindset and really requires a considerable amount of competence and development to do well.
Yeah. Well, very, very interesting topic, and I think you and I could probably keep going for a long time on this, but
we'd bore people to death.
Perhaps.
If we haven't already.
Perhaps. But great to start this conversation, and I'd love to continue it as this unfolds, because we're looking at this, I think, pretty significant shift, and Maine's in a pretty interesting place in the dynamic nationally as well.
Yes, absolutely, and it is. I believe we're going to be, I think we're going to be doing a much better job for people over time. It's very exciting.
Yeah, I think you're right. Well, thank you very much for coming in. Always appreciate it.
Thank you, Joel, very much.
And thank you all. Stay with us. We'll be right back.
Hi, I'm Denise Dumont-Bernier, the Director of Workplace Health. Do you want to work with a team of trusted occupational health specialists with many years of combined experience and proven results?
I would recommend Workplace Health because they have high-quality programs and people. They deliver what they promise, they care about our employees.
Do you want a healthier and more productive workforce?
CMLME has reduced its workers' compensation premium by 60% in the last 3 years.
Our employee wellness program, which is run by Workplace Health, has kept our healthcare costs flat for over 3 years. This has saved millions of dollars for Maine General Health and all of our employees.
You will get timely appointments for your pre-placement or DOT physicals. You can expect direct contact with our doctors and nurses and emailed results immediately following care at our practices. Join hundreds of other businesses in the greater Kennebec Valley and call Workplace Health, a department of Maine General Medical Center, to be your partner in health.
Maine Sense is not just health insurance. This is a new program based on reducing health insurance costs.
The costs were just too expensive. I couldn't put that on my employees with those type of premiums.
Maine Sense is unique because it's an employer-owned health insurance company.
It's the kind of plan that I'd always dreamed of being available.
While companies across the country struggle with the rising costs of providing health insurance to their employees, Maine employers are taking action.
Well, I think all the other health insurance companies we've been with over the years have brought to us reduced benefits for higher premium, and our employees are looking for something more than that.
Maine Sense is a health insurance program developed and owned by Maine employers in partnership with Martins Point Healthcare.
This is the first time I'd heard of a health insurance program that aligned the interests of employees, employers, and the healthcare providers.
It is a plan designed around preventive care and reducing the overall cost of health care by keeping people healthier, keeping their health insurance dollars in their pockets.
I feel that going with Maine Sense has empowered our employees. It's given them the tools to make the best healthcare decisions for themselves.
These and other Maine employers are taking a new approach to health insurance. Find out how to join them at mainsense.org.
I think Maine Sense is right for companies that want to take a proactive approach to managing healthcare costs.
This is a win-win for everybody, and we're really excited and looking forward to making this happen throughout our organization.
And now our perspective. Well, the discussion with Dr. Howes today, I think, encapsulates the shift that's really coming to our insurance market and our healthcare market. The whole concept of doctors not just caring for patients when they're ill, but helping to take responsibility for the health of the population at large. And to David's point, we've had this system for so long where people come and see their doctor when they're sick. And oftentimes it's too late to really maximize the intervention that they could provide as a physician. Getting to folks early and often to make sure that they're doing the things along the way that keep them healthy and avoid those high spikes. But it's interesting. This is going to take a shift on many, many levels, not just from what the physicians actually do and how their practices operate, but really how they're paid. And today our payment system is really not rewarding that type of behavior. And to David's point, we often get the result of what we're asking in terms of how our payment structure is set up. There's this whole concept of change and this general resistance I think we have, which is really part of human nature. But as this shift happens and as payment models change, there's not only a rebalancing and a refocusing and a realignment of incentives between individuals, patients, payers who are often insurance companies and employers, or even individuals, as well as the providers, and this realigning to make sure that the incentives are really all pushing in the same direction. But for that to happen, there is a certain amount of letting go that also needs to happen. Things can't stay the way they are indefinitely, and there will be some shakeup in the provider community. Some things will have to change in terms of how how care is delivered, and as well as who the players are and who are required to deliver that care. So it's going to be a very interesting evolution over the next several years. I think it's easy for us to look ahead and get a sense of where we want to go, but getting from here to there is going to be a challenge, and it's going to take focus, and it's going to take really a cultural shift that we're all going to be part of. And that's our perspective.
This is the truck that Jeff Baxter bought for his company with earnings from last year. This is the team that drove those earnings. This is the Harvard Pilgrim Health Screening that helped keep that team healthier. And this is the doctor's visit that happened because of the health screening that got this driver on the road to better health. For more than 40 years, Harvard Pilgrim has been developing innovative ways to make healthcare work better for everyone.
I'm a father and a grandfather. I've been a pediatrician for 27 years. You watch a kid grow up, and now that kid is a mom. We get to do the baby visits all over again. And don't forget yourself. We need you healthy too. Just because you have kids doesn't mean you stop being my kid. Anthem, Blue Cross, and Blue Shield.
It was the biggest race of the year. And no matter what, I was going to win. And that's when I realized that some things are more important than winning.
To teach us how to give,
including others. Pass it on. A message from the Foundation for a Better Life.
Inside Maine Healthcare is Maine's only show dedicated to healthcare in Maine. Brought to you by the healthcare industry and business leaders. Inside Maine Healthcare will bring you the practical information you need to understand what is driving our healthcare costs and identify the resources available for you to better manage your own healthcare. Learn how healthcare reform, new laws, and policymakers impact Maine business and consumers. Find out what business can do to offer affordable, comprehensive healthcare. Join us as we discover and implement innovative solutions to Maine's complex healthcare challenges to provide Maine people more affordable, sustainable, results-driven healthcare.